Welcome to my YouTube channel. My name is Dr. Willie Vidona of Michael Dr. V. We are going to talk about the Fontanelle. As a medical student, one of the commonest questions you can be asked when it comes to the score is a concept called Fontanelle. And so, get your pen and begin to jot down your questions. So by the end of this talk, you'll be able to send in your comments quickly, because I want to make this very brief. Let's go straight into it. If you're set, let's go. So the question could be, what is Fontanelle? The Fontanelle is that membranous portion of the skull found in infants. That membranous part of the skull usually found in infants. And the basic function of the Fontanelle is for expansion of the bones during and after birth as the brain enlarges. That is the basic function. Now, what are the types of Fontanelle? There are basically 4 types of Fontanelles. Number 1 is the anterior Fontanelle. The anterior Fontanelle is found around the brethren, usually around where the sagittal suture intersects with the coronal suture. It usually closes around the 18th month after birth. The second is the posterior Fontanelle, which is found around the area called the lambda. And this is around where the sagittal suture intersects with the lambda suture. And it closes around 3 months post-birth. The third one is the sphenoid Fontanelle. And this is around where the squamous suture intersects with the coronal suture. And it closes around 6 months after birth. The fourth one is the mastoid Fontanelle. The mastoid Fontanelle is found around where the squamous suture intersects with the lambdoid suture. And that closes around the 16 months after birth. Having known the types and the time of their closure, it is important you know that if there is a failure of these Fontanelles when they are supposed, it could lead to probably some kind of malformation of the skull. And some of the commonest malformation include 1, a situation where there is an abnormal closure of the sagittal suture could lead to a condition called scaphocephaly, whereby the skull appears pointed and narrow, long and narrow. There will also be a situation where the coronal suture fails to close when it's supposed to close. In this case, it could result to a condition called osteocephaly, whereby the skull appears pointed. The third one, there can also be a situation where the skull it appears triangular, and that is called triangulocephaly. Now, these are some of the situations that can arise if there is failure of some of these sutures. It's also important you know some of the clinical significance associated. One of the commonest one is an enlarged Fontanelle, anterior Fontanelle, which is always as a result of pathology. The commonest one is probably congenital hypothyroidism. There is also a situation where the Fontanelle could be sunken deep inside, depressed. Of course, this signifies what we call dehydration. There could also be a situation of an elevated anterior Fontanelle. In most cases, it could be as a result of hydrocephalus or excessive water within the skull. These are some of the conditions associated with the Fontanelle. At this point in time, if you are asked a question on the Fontanelle, I'm sure you'll be able to tell us the meaning, its function, its types, time of closure, its malformation, and the clinical correlates. Thank you. If you are able to find this useful, why not like this video, share with friends, and subscribe for more. Thank you.